I'm Lorraine, and today I want to talk about how to recognise the common symptoms of ovarian cancer and talk to your GP about them. This talk is dedicated to a very special woman. Sharon was diagnosed with clear cell ovarian cancer in 2011 and lost her battle in February of this year. I was diagnosed with ovarian cancer in 2011. Before my diagnosis, I'd never heard of ovarian cancer and certainly didn't know the symptoms. The ovaries are about the size of a green olive and are the female reproductive organs. In cancer, the cells grow too fast and make lumps called tumours. Ovarian cancer is only curable in the early stages. Any woman can get ovarian cancer at any age, and 1 in 50 women will have ovarian cancer at some point in their life. However, there are certain risk groups, such as women with a family history and women who have gone through the change of life. I was only 41 when I was diagnosed, and I have no family history of ovarian, breast or prostate cancer. I went to see my GP in February 2011. I had been having symptoms for a couple of months, but thought it was a digestive problem like irritable bowel syndrome, except that these symptoms weren't going away. I was getting them frequently, and some of them were new to me. Because of an ovarian cancer awareness campaign, my GP surgery had lots of posters on the wall of women and the 3 most common symptoms, and I had all 3. At that point, I knew this was more serious than I had thought, and it was the start of a very scary time in my life. However, the posters really helped me to focus on the symptoms, and then I was able to tell my GP what was wrong with me and what I was worried about. If you're nervous like me, it can really help your GP if you can keep a record of what symptoms and when you have them. You can do this with a diary, a calendar, or using an online symptom tracker. Ovarian cancer symptoms are common to lots of less serious conditions like IBS. This can make it hard for your GP, and many women often get misdiagnosed at first. What makes ovarian cancer different are that the symptoms are persistent, frequent, and new for you. It is unusual for a woman in her 50s to be diagnosed with IBS for the first time. Many of the cancer charities are working with professional training bodies to create online training modules for GPs which will count towards their professional development. As I said earlier, I'd never heard about ovarian cancer, and I didn't know about any of the symptoms until my diagnosis. But sadly, many women don't know about them, and because of this, women are being diagnosed too late, and we're falling behind other European countries. I was diagnosed at stage 4, and sadly it was too late for me. There is no cure. But if you are diagnosed at stage 1 or 2, then you're more likely to beat this disease. If you are worried about any of the symptoms or anything that's been talked in today's presentation, please make an appointment to see your GP, and thank you for listening.